Hey guys, this is Leah and you're watching Mommy in the Moment. Alright, so we're back with our doctor's office series. And this is going to be part 2 of common pregnancy symptoms that are very commonly not talked about. So if you haven't already, take a look at the first video. I'll link it above. And so this is going to be part 2, our second set of 10 common pregnancy symptoms. Again, I like to say, disclaimer, this is not a replacement for prenatal care. If you think that you're having an emergency, seek medical care immediately. All right? All right, so let's jump right into it. So number 1, headache. Headache is super common during pregnancy. It's because of the change in hormone levels. Your estrogen and progesterone skyrocket very quickly. Some people who never have headaches have frequent headaches. Some people who already have a history of headaches or migraines will have them more frequently. The important thing to know is if you're having visual changes like spots, floaters, lights, things like that, that is not a normal part of your migraine syndrome, you definitely need to talk to your doctor about that. Your headaches likely should respond to hydration, rest, and Tylenol, and if they don't, let somebody know. Emotions, heightened emotions, again, super common with any big changes in your hormones levels. It's okay if you cry when you're watching the Weather Channel. It's okay if you're eating breakfast and all of a sudden you're furious, or you get really sad because you couldn't find your sock. Like, these kind of things happen, and it's super normal. The other thing that's not an emotion, but also is very, very common, so I'll tag that one on to number 2, is pregnancy brain. That is a real thing. You got so much blood going to your uterus, and it's very common to be very forgetful, or feel like you say things multiple times, and or you leave the house without one shoe, things like that. Super common, happens all the time. Fatigue. The fatigue in pregnancy is real. It is so serious, especially in the first trimester. I think that's what really catches people off guard, is that the first trimester, you feel like you're not really showing, you don't feel like you have the big baby bump to validate how tired you are. But being an obstetrician, I know all the stuff that's going on in there so early in pregnancy. So if you look at an ultrasound at 4 or 5 weeks pregnant, there's just a little dot of fluid in the uterus. You can't even see anything. At 6 weeks, you've got a little jelly bean. At 7 to 8 weeks, you've got a little gummy bear with tiny little arms. At 10 weeks, you've got like a little teddygram, looks more kind of formed. And at 11 to 12 weeks, it's like a tiny human with arms, legs, fingers, toes. You can see a lot of the baby's anatomy. So your body is working really hard, even early in the first trimester. So if you're tired, girl, take a nap. You deserve it, because all of the organogenesis, or the formation of all the organs, happens early in pregnancy. After that, the baby's just getting bigger, which also takes a lot of energy, but you don't realize how much your body is doing that early. So the fatigue is real, but it's also warranted. Nasal congestion. So we talk about swelling, in your legs and your hands, that kind of thing. But it is also super common to have swelling all in here. When I was pregnant, I talk like this because my nose is like almost completely stopped up. I always kind of talk like that, unfortunately. I think it's just the way my sinuses are. But you can have swelling of your nasal passages. So some people actually have their nose run. They have what we call rhinorrhea of pregnancy. So clear, thin mucus that's just coming out all the time. But it's also common, like I had, that you have just swelling of the nasal passages. So there's nothing coming out. I feel like I need to blow my nose, but there's nothing to blow. It's just edema or swelling that's kind of blocking those nasal passages. Annoying, but also very normal. food aversions, or what some people really experience, smell aversions. Your sense of smell gets ridiculous. You can smell things a mile away. Things that didn't used to bother you, all of a sudden you can't handle. So for me, it was coffee. Now, if you know me, you know that I drink coffee every single day. And we talk about, you know, decreasing your amount of caffeine during pregnancy. And I was like, oh no, how am I going to do it? I don't even know if I can go without coffee. I'm going to get a massive headache from my caffeine withdrawal. But I couldn't stand the smell. In the first trimester, if somebody put on a pot of coffee, I had to leave the room. It was horrible. So that took care of that for me. And I'll do another video about caffeine intake and what is the true recommendations about that as well. The other thing is there's some foods. Oh, sorry. Cooking meat. My mom had the same thing. She couldn't smell food cooking. She wanted to eat. She was hungry. For me, it was meat cooking. So I told Chris, I was like, I am craving a steak, but you can't make it inside the house. So he went outside, he grilled me a steak on the grill so that I could eat it without smelling it. Bless his heart. But the smell aversions are real. Food aversions, things that you used to love, same thing. You may not be able to tolerate them. They may increase your nausea. So all of this is normal and it's okay, not dangerous, but very common. Kind of keeping in line with the GI system, heartburn. We touched on this in the last video, but heartburn is super common. We talked about progesterone relaxing all of your smooth muscle, all the muscles that kind of keep things moving forward in your gut. It also will relax something called the esophageal, the sphincter. So that's the muscle at the bottom of your esophagus that keeps the stomach acid down and keeps your food down into your stomach once you've swallowed it. Once that relaxes a little bit, it's very easy for that acid and stomach contents to kind of creep back up into the esophagus. The stomach is made to handle acid because that's how you digest your food, but the esophagus is not. And so whenever that acid creeps back up, it's horrible, it's burning, it's painful, and sometimes it can cause nausea. If you're contending with that frequently or it's really bad, definitely talk to your doctor about it. Sometimes Tums is not the best way to address it, and there may be something better that you can do to be more comfortable. Gas. People, when I polled the audience, thank you Facebook family for giving me some of these ideas. People said room clearing gas. And that again goes along with your GI system moving slowly. You know, if you swallow air, sometimes it's harder to manage that. Sometimes the way that you digest certain foods changes a little bit. And then everything is moving more slowly through your gut. So you get bloated, your stomach feels full. And then a lot of times when you pass the gas, it's more smelly because it's been in there longer. So that's, again, unfortunate, not pretty, but very common. Ooh, carpal tunnel. So carpal tunnel is whenever you get pain or tingling in your fingers. Sometimes you can get it in your wrist, but in your hands. Some people actually get weakness of their hands where it's hard for them to squeeze or make a fist. This comes from, you know, just like you retain fluid in other ways during pregnancy, you can retain fluid in the tissues of your wrist. Now the wrist has something called the carpal tunnel, where you have the blood vessels and tendons and nerves go through this little area, and there's a tendon that goes across it. This is a fixed space. So whenever it swells, something has to get compressed. And one of those things is the nerves. And the nerves don't like that very much. So they can get tingly, they can get numb. Every now and then it can affect how your grip is. And this, unfortunately, nerves take a long time to heal. So even after pregnancy, it can take a while for it to go away. So I had numbness in my last two fingers on both sides. And it took about 3 months for it to go away completely after I delivered. So there's hope. There is sunlight on the horizon, but this is normal, and sometimes it just takes a while for it to go away. All right, plantar fasciitis. The plantar fasciitis is when you get kind of stretching of the tendons on the bottom of your foot. It's very common because one, everything is relaxing, the pregnancy hormone, that kind of loosens up your ligaments and joints. And then you're also gaining weight during pregnancy. So I have flat feet already, so I'm already prone to this condition. And once you gain weight during pregnancy, it really puts a stretch on those tendons. And so it can be really uncomfortable, especially when you first get out of bed in the morning and your body and your joints aren't warm. It can cause really sharp pain on the bottom of your feet. Again, not dangerous for the pregnancy, super normal. And last, but definitely not least, lightning crotch. Yes, yes. I don't think women understand how common this is because people don't always talk about it. So before I had a baby and I was taking care of patients, people would say, I have pain inside my vagina. I'm like, you mean like outside? They're like, no, like inside of it. And I'm like, what do you mean? Like where you put a tampon? They said, yes, inside. And so once I experienced it, I was like, oh, that's what they mean. So what happens is your pelvic floor is comprised of muscles that go from the bone in the front, that symphysis pubis that we talked about in the last video, to your tailbone at the back, the one that if you fall wrong, it hurts really bad right between your butt cheeks. And it's kind of like a hammock of muscles. Now your urethra, where you pee from, comes through. Your vagina, where you have your period and where baby comes out, comes through. And then your rectum also comes through where you poop from. These all kind of come through that hammock of muscles that as the pregnancy gets heavier, has to work really hard to keep everything where it's supposed to be. Now, you can have muscle spasm in these pelvic floor muscles, and that can cause, it's like a Charlie horse in your vagina. So that causes really sharp, localized pain right where you're having that muscle spasm, and that's what people call lightning crotch. Again, super duper normal, really, really uncomfortable. If it's happening frequently and it's coming and going and coming and going, then you need to make sure that you're not having contractions. So call your doctor, have an exam done. But just a sharp, brief, almost like round ligament pain, but in a different location, really inside the vagina, super duper normal. All right, guys, I hope this was helpful. It was really fun putting all this information together and making this video. Pregnancy is beautiful, but sometimes it's not. And it's nice to know what things are normal and when to kind of get a little bit more evaluation done. So if you haven't already, please subscribe to this channel. I'm going to be making more kind of Doctor's Corner pregnancy videos about old wives' tales, how to deal with back pain in pregnancy. Lots of different stuff is coming. So definitely subscribe to the video, hit the bell so you know whenever I put new stuff out, and share this with anybody who, one, would find it humorous, two, is pregnant and has a lot of questions, or three, is thinking about becoming pregnant and wants to know kind of what to expect. For physicians, if you feel like this is helpful for your patients, definitely let them know about it. I just wanted to have a great, reliable source of information for people to come and say, you know what, this lady's a physician, she may know what she's talking about. And leave comments below. Tell me what else you want to see. But thanks again for watching. We'll see you in the next one. Bye.